Very much, Mr. Chair and Ranking Member Murray. To our panelists, thank you for your work and for your patience and attention this morning. Before we start, I do want to address the bipartisan funding agreement that the Senate reached yesterday to significantly increase federal funding to combat the opioid crisis, which is an important next step in strengthening our response to this epidemic. These new dollars need to be prioritized for states like my own of New Hampshire, which has been terribly and disproportionately hit by this crisis, and I'm going to continue to work with my colleagues to ensure that that happens. We also know that we will ultimately need far more funding beyond this measure over the years to come to truly address this crisis. So there are a number of us, as you hear this morning, who will continue to fight to do that. I want to thank the leadership of this committee because I think they have assembled an extraordinary panel. You all represent really the full scope of this terrible epidemic. The individual loss and the lives changed forever as a result, the long-term effects for our next generation that both Dr. Patrick and Dr. Bell are talking about as well. Mrs. Savage, as I heard your testimony, I was reminded of the experience of two Granite Staters, Jim and Jean Moses, who lost their 26-year-old son, Adam, in a somewhat similar experience to what you described with your sons. One of the steps they've taken is called the Zero Left campaign, and I take it from your nodding that you know a little bit about it. Would you like to address it?
Yes, it's a wonderful campaign that I actually just became familiar with. Jim has reached out to our organization about perhaps partnering with it to kind of help spread what they're trying to do. And what it is, it's a Zero Left, and it's a campaign to try to a catchy campaign to try to get people to clean out their closets and their medicine cabinets to leave zero left behind. They also have safety disposal for prescription medications that they can put them in a pouch and mix it with water, and it disposes of the prescription medication. So it's a wonderful campaign.
Yeah, and they're working with 5 hospitals in our state so that when a doctor prescribes an opioid, you're given that pouch along with a warning about the impact of even though legally prescribed drugs can have. So I'm glad you guys have connected. It's a real example of the work that so many families are doing to try to prevent this from happening to anyone else. So thank you. Dr. Bell, last week I was honored to have a woman named Mackenzie Harrington-Baycoat join me as my guest for the State of the Union. Mackenzie works as the program administrator for the Office of School Wellness in the Laconia School District in New Hampshire. That office focuses on preventing substance misuse and addressing students' all-round behavioral health and wellness. Laconia has been very hard hit by the epidemic, and the schools are really working with federal funds to stem the tide. They have seen a great improvement in student well-being by providing kids counseling, meals, and other support so that they are better able to learn, engage in the classroom, and cope with challenges at home. So, Dr. Bell, you've worked with school-aged children your entire career. Can you speak to what more schools should be doing to help facilitate student well-being, especially in schools where children may be exposed to substance misuse in their homes or communities, and how can we here in Congress support those efforts?
Thank you, Senator, for the question. You know, I think schools have always been and should continue to be a core frontline institution in whatever ailments we're challenging in our communities. And I think particularly with the opioid crises, the school can become a very safe haven for young people. But as we know that there's a lot going on in our schools, and that means that we've got to change our approach that we're taking. I think that we need to focus less on the policing that we're doing in our schools and more on the protecting. And that we need to have conversations with the community, and that our schools should not close down at 3 o'clock. The schools have to become that school-based community center where our children and our families can go to get protection, to be safe, and to learn how to protect their lives and to improve the conditions that they're living in. And I think there's much more that we can do in that area.
Well, I thank you. And to both you and Dr. Patrick, one of the things you've both been talking about is the importance of integrated care and services and prevention that can come with that kind of integrated service. In my experience as a governor, it takes resources to actually coordinate and integrate things. You can't just kind of say it's a good thing. And so there are a number of us here, myself included, who will be fighting to get you guys on the front lines, those kinds of resources. We are so grateful for your work. Thank you, Mr. Chair.
Thank you.